Good evening, everyone. So today we are going to discuss a very important topic, image optimization in the Doppler evaluation. So starting with the very basic, the Doppler frequency shift principle. So this is our ultrasound probe, right? So this ultrasound probe is going to transmit the pulse, the frequency, which is the transmitted frequency, which will hit the RBCs and get reflected back to the transducer for further processing. So the frequency that is being transmitted is FT and the received frequency is FR. Okay. So this, if you take difference of this, it is known as the Doppler frequency shift. So Doppler frequency shift is the difference between the transmitted and the received frequency. A very important concept is regarding the Doppler angle. So this is very important. Yes. So Doppler angle is the angle between the direction of the ultrasound beam and the blood flow. So the angle formed between the ultrasound beam and the direction of flow is Doppler angle. Don't confuse it with the angle which is between the skin and the vessel. Some people have that doubt. So we are dealing with the Doppler ultrasound. So it's the angle between the ultrasound beam and the blood flow. Okay. Then coming to the velocity calculation. So Doppler frequency shift. This frequency shift is going to help us determine the velocity. So in summary, the factors that are going to affect the Doppler shift are the transducer that you are using for your ultrasound, its frequency, the received frequency, okay, the FR, then the velocity of the moving reflector. So the RBC is the reflector in our case, the angle between the ultrasound beam and the blood flow, and the velocity of the sound in the medium which is reflecting it. It will vary from medium to medium. So the velocity of sound in that particular medium. Is it clear? So what is the principle? What is the principle of Doppler? The received frequency subtracted by the transmitted frequency will give us the frequency shift or the Doppler shift, right? And everything is now going to rotate around this frequency shift. So when the ultrasound beam is transmitted from the transducer and they get reflected from the RBCs, the frequency that is being reflected will depend on the direction your RBC is moving. Okay, so the frequency change, it can be positive frequency shift or a negative frequency shift depending on the direction of the moving RBCs. And the frequency shift, the difference will be depending or is proportional to the velocity of the moving blood. Okay. So our equation, this is the Doppler equation. It is very important and can be asked in Viva. It was asked to one of my batchmates. So don't get panicked. They don't want to know everything. If you just tell the relations also, it would suffice. But now when we are studying in detail, we'll know each and everything. So the frequency shift is proportional to the velocity of the moving object. In our case, it's the blood. What is C? The speed of sound in that medium. Then the angle. The Doppler angle is very important because it's helping us in calculation of velocity, and it is one of the factors which is modifiable. You are going to change this angle. So depending on the modification, your velocity can be spuriously elevated or it can be decreased. It can be 0 also if your angle is 90. So this is one factor which is something which you will be manipulating, right? Then the transmitted and received frequencies are the parameters that your machine is going to calculate. So the greater the blood flow velocity is, higher the Doppler frequency shift is, right? So we see the relation from here only, it's directly proportional. Now, when you are doing this, the scan, frequency shift, you will know the frequency that your machine is transmitting and the frequency that the probe is receiving. So you know the Doppler shift, right? Angle, or the angle of the Doppler, is something which is being set. So this is also known. C is also known, right? The only parameter which is not known is velocity, and hence it can be calculated. So this variable gets calculated. So ultrasound machine calculates the flow velocity and the flow direction based on the amount of frequency shift. And that's why we are discussing frequency shift over and over again, because this is the baseline which is going to give us all the parameters. Okay. So how do you interpret the frequency shift? So if the received frequency is higher than the transmitted frequency, that means your flow of the object or the RBC is towards the transducer. Okay. And if the received frequency is lower than the transmitted frequency, that means RBCs are moving away. So in this case, this is positive frequency shift and this is negative frequency shift. By default, positive frequency shift is depicted as the red color, that is the flow towards the probe, and in spectral Doppler you will have the antigrade wave. Okay, so in spectral, the part which is deflecting above the baseline is the positive frequency shift. If you invert it, then the findings change. Just remember, the maximum Doppler shift that can be detected by a machine or the pulse Doppler system is half the PRF. This is one basic principle that will help you tell the concept of aliasing. So just remember, the maximum Doppler shift that any machine can detect is half of the pulse repetition frequency. So whenever your PRF is less than the Doppler shift that is happening at the source, aliasing will happen. Okay. So the ultrasound system uses this Doppler frequency shift to give us a quantitative and the directional flow estimates, and will use this data to generate color-coded flow maps of vasculature for better visualization. So you will have maps also, and you have quantitative data. We can calculate the PSV, EDV, RI, PI, SD ratios and whatnot. So in stationary object, you see the frequency and the wavelength of the transmitted and received frequency remains the same. So whatever was sent has come back as such. If the object is moving towards the probe, then the frequency is going to increase. This is the positive frequency shift. And if the object is moving away, then the frequency decreases. And this is the negative frequency shift. So there are few important topics, that is the terms, which will come again and again when we are doing Doppler and we are studying it. The most important concept is of aliasing, and we have a bit number of slides for discussing the aliasing part. So just remember that insufficient sampling or the rate or the PRF, if it is less relative to the frequencies which is being received, so your FR is higher and your PRF is low, then you will have aliasing. Okay, we'll discuss this in detail. So just remember this much for now. Some terms like attenuation, everybody knows what is attenuation. The ultrasound beam, when travels to deeper parts of the body, it attenuates. So when it attenuates, while the propagation through the tissues, then the signal that are received are also attenuated. And to combat these, we use the gain. So we amplify the signals which were attenuated. Then baseline. What is baseline? It is a division which is going to separate the positive and the negative Doppler shift. So in this diagram here, you are seeing this black line, or now I've drawn it with blue. So this line is the baseline. It is deciding the line where